Have you ever asked yourself, why are my gums receding? That's not your imagination. It's actually and probably gum disease and recession. And today we're going to kind of break down why it happens, what it means, and what you can do about it right now. Picture a beach after a storm. Each year, the shoreline pulls back a little bit more and more. The ocean hasn't changed, but the land is slowly disappearing. Gum recession works the same way. It's slow, it's sneaky, and if you don't catch it early, it can actually reshape your entire smile. What causes gum recession? Here's what my research and clinical experience shows. Aggressive brushing with a hard bristle brush, grinding and clenching put stress on your gum tissues. Also, if you have like crooked teeth or misaligned teeth, this can also lead to recession. Any use of tobacco products causes recession. And then there's even genetics. Some people are just born with thinner gum biotypes. So those are the things that you have to really kind of think about when it comes to gum recession. So what do you need to watch for? Warning signs for recession: the teeth may look longer than before. Sensitivity when brushing or drinking cold drinks, that's a sign of recession. Notches at the base of your teeth, that is a sign of recession. Gums that look uneven or pull back, and exposed root surfaces. What can you do right now to help slow down this recession that we're talking about? The first thing that I'll recommend is making sure that you're using a soft bristle toothbrush and using a gentle technique. A lot of times we see people that brush their teeth with their dominant hand, and so if I'm a right-handed person that's brushing my teeth, the left side is usually the ones that we see with a lot more recession than the right, because you're dominant, you always go to the left, and you go in, and you're going in, and you're going in, and you really start to do a lot of damage to your gum tissue. Another thing that we notice when there's patients that have recession is they use an electric toothbrush without a pressure sensor. Why is this important? A lot of toothbrushes nowadays have a little light at the base of it, and that light will show you you're pushing too hard. And that light indicates that you need to apply a little bit more of a gentle pressure to that particular area, because it actually helps to ensure that you don't have toothbrush abrasion. And we'll talk about that later. What you can do now: you need to floss gently, but also consistently. This helps to remove some of the soft plaque. So after you get cleaned up, using flossing techniques where you're not necessarily just throwing that floss in there and pulling it back out, that is detrimental to your gum tissue. And so when it happens like that, you can also start to see a lot of recession and bone resorption too. Another thing that you can do is get gum disease treated early. This is something that has to be diagnosed by a dentist, and then during that time we'll talk to you about what periodontal disease is, and then also looking to potentially find solutions for you to help slow it down. It may not be able to just stop it completely, but slowing the process down will obviously help us to ensure that the teeth and the gums don't recede even more. So this is for my folks that grind their teeth. You got to wear a night guard. If you're grinding and clenching your teeth and you know it, put on a night guard. There are an array of them at grocery stores. So just make sure that you're really controlling the amount of clenching and grinding that you have, because it does affect your teeth. The main thing too you want to also look at to help prevent it is your toothbrush technique. You want to have proper angulation, and you also want to make sure that the pressure that you're putting on your teeth is not too severe. Now, I got a question for you. Have you ever caught yourself brushing too hard, like scrubbing like a dish? Like, be honest. Comment guilty below if that's what you do. I know you guys have been waiting on this. Can your gums grow back if you have gum recession? The truth of the matter is, not really. Once gum tissue pulls away, it doesn't just grow back naturally. But here's some things that we can do. We can stop it from progressing. We can cover the exposed root with grafting, tissue grafting from other areas. We can also strengthen your routine to prevent future loss. Again, we just want to make sure we maintain. So wherever you are, we want to maintain it and not allow it to get more severe. Some of the early stages of recession can be improved cosmetically, but prevention is key. So let's just recap what we learned about. Gum recession is more common than you think. It's often painless, but it's not harmless. Causes include brushing too hard, grinding, gum disease, and then also Prevention starts with gentler care and regular dental visits. So what's next? What you need to do? So I have an array of videos that you can tune into to figure out whatever it is going on with you. There's a video about dry mouth, what causes it, how it affects your teeth, and how to treat it naturally and effectively. It's been an honor. You guys be blessed. Talk to you real soon.